Good morning and welcome to your Farm and Home Show. I'm Kristi and this morning we're visiting with Bethany Crask. She's a registered dietitian at the Barren River District Health Department. Good morning, Bethany.
Good morning, Kristi. How are you doing?
I'm doing well. Now, Bethany, many of our lives have been touched by diabetes in one way or another, and today you are here to tell us what exactly diabetes is and why awareness matters.
You're so correct on that. So often we hear the word diabetes or we know people with diabetes, and it's framed in really scary or daunting terms. And so it's just so helpful to be aware of what diabetes actually is and to be aware that it is very treatable. Even if you do have it, a lot of times it can be preventable. It's not always, but can be preventable as well. And so diabetes, as a definition, it's just when your body doesn't process carbohydrates correctly. So you think about carbohydrates, a lot of people think bad, and carbohydrates are not actually bad. They provide energy for our cells, for our bodies. For example, our brain relies solely on carbohydrates for energy. And so whenever our body's processing carbohydrates into sugars, there's a key, which we call insulin, that allows insulin and sugar to get into the cell as energy. So there's two different types that we know about or that people would be aware of. There's type 1, it's when your body doesn't produce enough insulin or doesn't produce insulin at all. And so people with type 1, a lot of times it's more genetic. A lot of times it's associated with a younger age of diagnosis, and it's just you don't have the insulin, so you don't have the key. And so it can be very treatable with insulin. And then type 2 is a lot more common. About 90% of diabetes is type 2. And that's when your cells are just resistant to insulin. And so they don't function as it should, where the key can't necessarily get into the cell to allow your body to use that energy from carbohydrates.
What does it look like to live with diabetes, Bethany?
For diabetes, a lot of times it depends. So specifically for type 2, just because that's so much more common in Kentucky, it looks like if you're proactive, a lot of times it can just be managed with diet and exercise. A lot of times some people do need insulin, and they can work with their healthcare provider and with dietitians and with nurses who are happy to help them figure out what an insulin regimen looks like. Sometimes it's treated with medication, but a lot of times it's just treated with diet and exercise of being conscious about what types of carbs you're eating, how much you're eating, and how frequently. It's not that you don't need any carbohydrates at all. You just need to be a little bit more intentional with it and a little bit more conscious with it. And it looks like being educated and reaching out to people and reaching out to healthcare providers who are happy to help you make it a lot more manageable.
How can someone know their risk for developing diabetes, Bethany?
So there's a lot of different risk factors out there. You can go to the American Diabetes Association website, which is super helpful with tons of resources about diabetes. A lot of times you can go to screenings, you can get your A1Cs tested, your fasting blood glucose tested, which is going to be very helpful. Or if you have a family history of diabetes or a history of gestational diabetes, that's going to put you at risk as well. And so if you reach out to your healthcare provider, or if you go to the ADA website as well, that's going to be very helpful. Or you can go to the health department website, and we have some resources on there as well.
Now, Bethany, if someone has questions or they want more information on diabetes, how can they do that?
So I would love to be a resource for them, specifically in the Barren River District area. You can just go to the Barren River District webpage or the Barren River District Dietitian webpage as well and reach out to us, and we'd love to connect. Or they can just go to the Kentucky government's webpage and you can find all of the resources in a resource directory there as well.
All right, Bethany. Well, thank you so much for sharing so much information on diabetes. If you are watching and have any questions, be sure to contact the Barren River District Health Department. Thanks for watching, and we hope you have a great day.